joined by leading cardiologist and electrophysiologist Dr Boon Lim to discuss atrial fibrillation, one of the most common heart rhythm disturbances in the UK. Good afternoon, Dr Lim.
Good afternoon. Thanks for having me.
No problem at all. It's really nice to have you here. It's a pleasure. So could you tell us more about yourself and your work?
So I'm Boon Lim. I'm a cardiologist and electrophysiologist, and I'm based at Imperial College Healthcare NHS Trust and Imperial College London in Hammersmith Hospital, one of the major tertiary teaching hospitals in London. I have a strong interest in arrhythmias and in particular atrial fibrillation, and I've got a strong research program looking at the role, for example, of the autonomic nervous system in atrial fibrillation. I also lead the Imperial Syncope service, where we see a lot of patients who faint. And in general, I do devices such as pacemaker implantations and cardioverter defibrillators. So I'm a cardiologist with an interest in electrophysiology based in London.
Great, thank you so much. So let's get started with the questions. Atrial fibrillation is one of the most common heart rhythm disturbances in the UK. What are the further statistics surrounding it, especially regarding age and who it affects?
Sure. So atrial fibrillation is the most common cardiac arrhythmia worldwide. And actually, it affects 1.4 million people in the UK. And that represents around 2% of the unselected population. Now, when we drill down into the age group, atrial fibrillation is really, by and large, a disease of aging. And therefore, we see approximately 4 to 5% of patients over 60 with atrial fibrillation. And by the time patients get to 80, approximately 10% of the population have atrial fibrillation. Globally, it's estimated that around 0.5% of the global population has atrial fibrillation. That's not to say it's exclusively a disease of age. There are some younger people, such as those between 30 and 50, who do get atrial fibrillation as well. And those types of patients tend to have particular risk factors.
Right, that's really interesting to know. As a person that is just over 30, that's very interesting. Okay, so next question. The Stroke Association reports how it is estimated that many people are living with undiagnosed atrial fibrillation. So what are the signs and symptoms that people should look out for?
Well, atrial fibrillation, first of all, is an irregular rhythm. So it's characterized by this flip-flopping of your pulse rate or palpitations. So when we say palpitations, which are the dominant and most prevalent symptom of atrial fibrillation in patients, it's a sensation that one feels when one is aware of a heartbeat that is irregular, which is either pounding or beating in an erratic manner. So one top tip for your patients to really get a feel of your pulse is literally learn to take your pulse. And the best way I can teach you to take control of your pulse is to take out your, I guess, left or right hand, thumb side down, and just about at the end of your crease, take two fingers and feel the pulse on your thumb side down. And there you can try it yourself now. Yeah. And feel firmly on the thumb side down, just about half an inch below your wrist. And you should be able to feel a pulse, which if you don't have atrial fibrillation, should be regular, both in its cadence, which is every few beat, or every beat feels the same interval apart, but also in its volumes. So the way that it bounds, the way that it comes up and hits you. Those are the two things that you can feel about your pulse. And actually in atrial fibrillation, it is normally quite obvious when you take a pulse check, because you should be able to feel an irregularity in your pulse. That means no two beats are exactly the same. And secondly, the pulse volume, how much it bounds in each heartbeat, can be very varied, with some beats being very strong and some being very weak. Now, of course, that's if you want to check your pulse, and if you can check your pulse. The other place, by the way, to check your pulse is your neck. So if you look at your, for me, the Adam's apple, or just where your thyroid gland might be, move slightly to your left or right, about 1 inch, and then just press slightly firmly. And here you might get a sense of your carotid pulse. Can you feel it? It's a very should be a fairly nice bounding pulse, and you can feel it with 2 fingers. And again, you're looking for that regularity and you're looking for that pulse volume. Okay, if either of those are normal, then you should see your doctor. But in terms of what you feel or experience in atrial fibrillation, it's typically a switch in your comfort level, because we don't normally feel our heart beats, right? But in atrial fibrillation, we might suddenly become aware that our heart is beating or pounding in a very unusual way, that goes beyond the pounding that you might feel, for example, if you ran after a bus or you were doing some exercise. This feels different to that. The other thing that atrial fibrillation can cause in the absence of palpitations, if you don't, for example, feel palpitations, would be symptoms more general uh, of a more general nature, such as shortness of breath, a bit of chest pain, lightheadedness, and fatigue. And at night, sometimes people can't get to sleep properly, or they feel very unsettled. For example, if they're lying on one side or another, for example, on the left side, they feel their heart bounding. That can also be an early sign of atrial fibrillation. So those are the top tips to look out for atrial fibrillation.
Great, thank you. Well, fingers crossed. My atrial fibrillation is non-existent. It feels okay to me. That's great.
Very good to hear.
The next question, how do the symptoms and associated complications affect patients' quality of life? And you mentioned before it can be worse at night. Is that the case?
So the symptoms of atrial fibrillation can be quite apparent in some patients and actually quite debilitating in some others. But equally, it can be completely non-existent, as in the symptoms that you get. In fact, you might not have any symptoms, even if you have atrial fibrillation. So really, the top tip here is to learn to do a pulse check. And actually, that comes back to what I was demonstrating to you earlier about checking your carotid pulse and checking your radial pulse. But in terms of symptoms, the most typical symptoms that we see will be symptoms of palpitations, which is the sensation of your heart flip-flopping about, but also breathlessness, more fatigue, effort intolerance. That means you can't do as much as you used to be able to do, altered sleep patterns, and then at night, possibly even increased frequency of urination. I know it's an odd symptom, but some patients say, I'm getting up to pee a lot more at night. And one of the reasons for that is in atrial fibrillation, it's typical that your heart rate just jumps up and steps up, for example, from a baseline of 70 beats a minute to say 100 or 110, and there it stays day and night. And at night, when we're not used to such a high heart rate and such high flushing of the kidneys, we don't normally produce urine. In atrial fibrillation, we can sometimes feel the need to urinate more at night. So it's a subtle sign and an interesting one, but those are the kind of things that you can pick out at night. Of course, you might find it more difficult to sleep, difficult to get settled down because something feels not quite right. It's worth checking your pulse always.
Absolutely, great, thank you. So are there different types of atrial fibrillation? And are there some that are more serious than others?
Sure. I mean, that's a great question. Essentially, there are 2 forms of atrial fibrillation. The first form is an intermittent form where for most of the time you are in normal rhythm, and then atrial fibrillation hits, and it might hit and affect you for example, 30 seconds, 2 minutes, 2 hours, or 2 days. And that flip-flopping in and out of rhythm is called paroxysmal atrial fibrillation, what we call PAF as doctors. And that form of atrial fibrillation is also known as the intermittent form. So when patients start off having atrial fibrillation, it's very typical that they start off in this form, where the heart rhythm goes out of sorts and they feel the palpitations for 1 or 2 minutes and then it settles down. It's very important that you try and identify common triggers for these short-lived episodes of intermittent atrial fibrillation. And some common ones could be alcohol, stress, overexertion, caffeine. And an interesting one that is emerging now is the epidemic of obesity is leading to a lot of sleep apnea, obstructive sleep apnea. And if you find yourself gasping awake at night with palpitations, and you fear that you might have sleep apnea because, for example, your partner has to kick you at night to wake you up when you're snoring too loudly, then suspect atrial fibrillation. And when you wake up with that gasping palpitations, check your pulse. So that is the paroxysmal form, the first form. The second form is called persistent atrial fibrillation. And that's the case when you go into atrial fibrillation, but you don't come out of it and you stay in it continuously. So, for example, and the most common example here is somebody who, for example, comes into hospital with a chest infection or urine infection or sepsis, or has a thyroid abnormality, and they find that the rhythm has gone out of sorts and it doesn't spontaneously revert. That form of atrial fibrillation will be persistent, which means there all the time, and that is the second form of atrial fibrillation. Oftentimes, if we leave paroxysmal or the intermittent form unchecked, the frequency of symptoms and the duration of each episode will both get longer, and therefore, or more frequent and longer. And at some stage, there can be a transition point where you move from the more milder, we say, intermittent paroxysmal form to the more persistent form of atrial fibrillation. Both these forms of atrial fibrillation, I think, are equally important to treat, and to treat rapidly, to get the stroke risk under control and to get symptoms under control. Now, if I just expand slightly on the major risk of atrial fibrillation and what complications that could arise from being in atrial fibrillation, the first and foremost and most important risk is the risk of stroke. And so we need to learn to assess if we have atrial fibrillation or not, and thereafter assess the risk of stroke, because the strokes that you get if you have atrial fibrillation are much more devastating than a normal stroke. Atrial fibrillation can triple your risk of stroke. So it's a very important risk factor to have a stroke, and you should see your doctor to get this quantified and have a stroke risk stratified.
Great, thank you. Yeah, it's absolutely important. People really do need to go to their doctor to get checked. Absolutely. How is atrial fibrillation managed, both medically and at home? And in your new book, Keeping Your Heart Healthy, do you address how patients can manage it at home?
Sure. So I think I need to break that down into two components. The paroxysmal form or the intermittent form of atrial fibrillation is normally managed very well if you can identify the triggers of the intermittent bursts of atrial fibrillation. For example, if you have a very long day, or say you caught an early flight, you arrive at your holiday destination, and then you drank half a bottle of wine, which is very unusual, and then had a late night and woke up at night with atrial fibrillation. Well, the triggers there are very obvious. It's exhaustion, stress of travel, and alcohol. So one way to manage that form of recurring atrial fibrillation, for example, which occurs after a long day of work with some alcohol, is to really be mindful of the triggers, and avoidance of those triggers should really minimize subsequent episodes of atrial fibrillation. If you have atrial fibrillation, which is paroxysmal, that comes out of the blue without any clear warning triggers, so you've looked at the relationship with coffee, with alcohol, with stress, with lack of sleep, with sleep apnea potentially, and you can't identify a reason, then I think trigger avoidance won't work because you can't really figure out what the trigger is. I think you need to see your doctor, particularly if the symptoms are getting more frequent and they become bothersome, because there are often certain drugs that can be used in a stepwise manner. The first of these drugs are prescribed in a pill in pocket approach. That means what it says on the tin, which is when you get an episode of atrial fibrillation and you know you have it because you have a pulse check, or you have a modern ECG recording device like an Apple Watch, for example, and you diagnose the atrial fibrillation, you can often take 1 or 2 tablets to help you get out of the atrial fibrillation fairly quickly. And you can know when you're out of it because you often feel it snap back into normal rhythm. So that is called a pill in pocket strategy. The second strategy beyond that is called a regular drug strategy. So you take the drugs all the time, and these drugs stay on board, taken either once or twice a day, every day, and that minimizes the occurrence of these intermittent forms of atrial fibrillation. Typically, if these drugs are not tolerated, or you wish to not consider a drug and go for a more definitive solution, then one can consider a catheter ablation procedure. And this is a procedure which is done quite safely through a keyhole approach from the groin, where little electrodes or catheters are placed within the heart to perform the ablation of the sites in your heart that are responsible for triggering atrial fibrillation. And that's called typically a pulmonary vein isolation procedure. I know it's technical, but essentially the steps are avoidance of triggers, pill in a pocket drug, regular drug, and an ablation procedure. Those are the 4 steps for the rhythm control of atrial fibrillation. Separate from that would be the stroke risk prevention or stroke prevention. And all patients with atrial fibrillation should at least have the stroke risk assessed by a doctor. But you can do it yourself by thinking about the following factors. If you are older than 65, your stroke risk is higher. If you have hypertension, diabetes, a previous heart attack, previous claudication, which is narrowing in your leg vessels, and heart failure, or a previous stroke, these are risk factors that predispose you to having a stroke if you have atrial fibrillation. And if you have any of those factors that I just mentioned, then you should seriously see your doctor quite soon to consider the role of starting anticoagulants to stop you having a stroke. Now, on the persistent side, I think that the stepwise managements are a bit different because clearly there's no trigger to avoid. You're in AF all the time. We don't really want to go down a pill in the pocket approach because that doesn't make sense because you have AF all the time. So we're really talking about the therapy, which includes drug therapy regularly, but a second therapy that I didn't discuss earlier on, which is an cardioversion procedure. A cardioversion is an electric shock to the heart delivered by pads that we place on the chest under a very short general anesthetic. And then we charge the pads and deliver an electrical shock through the heart to stop and restart the heart. Oftentimes that cardioversion procedure can get you back in normal rhythm. And then you see your cardiologist to see if you can maintain normal rhythm for any length of time. Typically, if you have a cardioversion and you fail, that is to say you go back into atrial fibrillation a day after, a week after, a month after, you can then be considered for the ablation procedure afterwards. So those are the 2 kind of nuanced differences between the treatment of paroxysmal and persistent atrial fibrillation.
Great, thank you so much. That's really interesting to hear and how clear you've made it. It's amazing. It's really good.
Thank you.
Final question. Can patients live a long life if atrial fibrillation is treated properly?
So the answer is yes. I think a life expectancy of somebody with atrial fibrillation is the same as somebody without atrial fibrillation, with one caveat. So atrial fibrillation is usually a condition that is brought about by lifestyle or risk factors that exist to promote the heart into going into atrial fibrillation. We spoke right at the beginning, and I said there is this curious group of younger patients, say between 30 and 50, who do get atrial fibrillation. And those patients tend to be patients who are vaguely driven. So this word vagus relates to one of the components of the autonomic nervous system. And in my experience now, I'm seeing more and more what I would say fit 40 male executives who are bombing down or going uphill on their bike or peloton with ultra endurance sports, right? So that's a typical mammal or a middle-aged man in lycra. I know it's a stereotype, but I'm seeing more and more of such patients in their 30s and 40s who have picked up rowing, picked up cycling to a very high level, doing marathons and triathlons. And because of that, they're getting a bit of atrial stretch physiologically, because as they do more exercise, their heart, which is a muscle after all, gets bigger and stretches. And that can sometimes promote atrial fibrillation. So, I mean, it's an interesting point about what to do about those patients, but that form of atrial fibrillation is something that's called vagally mediated atrial fibrillation. In the vast majority of the other patients with atrial fibrillation, that tends to be risk factor associated. And that tends to be patients who go on to develop the kind of more persistent form rather than the paroxysmal form of atrial fibrillation. So let me give you an example. If somebody has a high BMI, has hypertension, diabetes, has had a previous heart attack, well, those are risk factors that would predispose you to atrial fibrillation. And if you were to develop atrial fibrillation in that context, your life expectancy may not be shortened necessarily by the atrial fibrillation itself. But if you don't get control of the hypertension, the diabetes, the coronary risk factors, that's something that can shorten your life. So in my mind, I think a really holistic approach is needed for atrial fibrillation, because we shouldn't just focus on the rhythm. And although I'm a rhythm cardiologist or an electrophysiologist, I often start the conversation by asking the patients about lifestyle and risk factors that promote cardiovascular disease, because those same risk factors also promote atrial fibrillation. And although I like fixing atrial fibrillation, it's not really a holistic view. You should treat atrial fibrillation, but more importantly for the patient, you should educate and teach them about all these other risk factors that continue to drive coronary heart disease. And this is the one thing, or the focus of my book, Keeping Your Heart Healthy, is where I've broken down all these different components such as hypertension, ischemic heart disease, hypercholesterolemia, fainting, and rhythm disorders such as atrial fibrillation, the impact of nutrition and stress on the heart. I've broken each of these components down in chapters so that at the end of the book, you can recognize a really holistic approach to improving your overall heart health, not only for atrial fibrillation, but for your overall well-being, health and well-being.
Fantastic, thank you so much. I think that's really interesting in relation to a recent series that's been on HBO Max, which is absolutely one of my favorites, which is called, well, it's an offshoot of Sex and the City, and it's called I'm Just Like That. And there is a character in the series that is a middle-aged man who has all of those risk factors that you've described. He smokes cigars, he drinks alcohol quite a bit, and he was on a peloton, and it was a disaster. It was terrible. And it's just really interesting that this series has kind of reflected just what you said, and how true to life it can actually be. So I think people need to be made aware of these kinds of things.
Well, I would take it a step further. One of the great reservations about seeing a doctor is you don't really want to face being told
Mhm.
the things that you don't really want to hear.
Sure.
And actually, a lot of our lifestyle, mine included, actually involves very long days at work, very little time for self-care, and
Mhm.
very little time for self-learning, because you're so good at your job, you're in your silo, just working, beavering away in whatever profession you are in, engineer, teacher, whatever, executive. And actually, your job, which is so 8 to 8, for example, doesn't allow you time to learn.
Mhm.
Well, that's when I think you should really pick up a very easy way, perhaps even in the absence of seeing a doctor, to learn about your own health. And there are many good podcasts out there. There are many good books out there. I'm hoping that people will pick up and read Keeping Your Heart Healthy, but that's not the only cardiovascular book. That you can actually learn about your own health and learn about healthy nutrition, healthy exercise, and healthy self-care and healthy stress management. I think a lot of what we as a society have moved on to now is this aspect of care that can come later when I slow down, or when I don't have to do X, Y, and Z, when I don't have to get the kids to school, when I don't have to earn so much money to pay the bills. Well, that pushing it forwards or kicking the can down the road is not an approach that is compatible with an overall good health in the long term. You have one time in your life to do something about yourself. And that time is not when you take a break or vacation in 3, 5, 10 years time. That's not the time in 20 years time when you retire. The only time you can do something about yourself is now, because this is the moment we can act, we can think. There's no point thinking about the past or blaming your parents for your poor genetics and the feeding habits and all this kind of stuff. There's no point looking forward to the future and saying, oh, when I have time, if only I could, when I retire, because that is always going to be a can that's kicked further and further down the road. So the only time is now. And that's one of the points that I also make in the book in the final chapter, which is do something about it and do it now. And it doesn't need to be taking time off to see a doctor, just educating yourself by reading or by listening to podcasts will be helpful enough for you to make that first step that needs to be made into self-care, into health and well-being.
Perfect. Thank you so much. And that's been absolutely amazing, really, really interesting. It's been a pleasure. If you're looking to find out a little bit more or a lot more information about atrial fibrillation and heart conditions, then Dr. Lim's book, Keeping Your Heart Healthy, is available on Amazon. Or if you would like to make an appointment with one of the leading cardiologists in the UK, you can visit Dr. Lim's profile at topdoctors.co.uk.
Thank you very much.
Thank you.